Thanks very much indeed, Jamie, and good morning, Bore da. A croeso I chi gyd, a very warm welcome from me also to this very important event in the development of the single integrated plan for Pembrokeshire. As Jamie just said, I'm Chris Martin, Chairman of Hywel Health Board, and very proud to be Vice Chairman of Pembrokeshire Local Service Board. So just a few words from me regarding Hywel Health Board, the challenges facing the NHS in Wales, and how we must change from a sickness service to a wellness service, the pledges we have made to our population and how we need to support of all our partner organisations to be successful as part of an integrated plan, not just in Pembrokeshire, but across the three counties of Pembrokeshire, Ceredigion and indeed Carmarthenshire. So, Hywel Health Board was established in October 2009 and has the responsibility to provide safe, sustainable healthcare services for everyone in Pembrokeshire, Ceredigion and Carmarthenshire, and to improve the health and well-being of our population. The NHS across Wales faces significant challenges over the coming years, and in fact by 2031 the number of people over 75 will have increased by 75% since 2001. A third of adults in Wales have at least one long-term condition, such as asthma, diabetes or arthritis, and older people are more likely to have a chronic illness, and an increasing elderly population means that the number of people needing treatment for such conditions will also rise. Conditions that were once untreatable are now more manageable, and people are living longer. Although this is a success story for the NHS, it puts more pressure on health services. And as we all know, funding in the public sector is under unprecedented pressure. And if we are to meet these challenges, we must change from being a sickness service that treats people when they become ill to a wellness service that helps people stay healthy and prevent sickness. We want to add life to years and years to life. However, if we are to deliver this vision, we must redefine the way that we work. Our population must also start to take more responsibility for their own health. Smoking, poor diet, and excessive consumption of alcohol all have a major impact on health and often lead to people suffering from long-term but avoidable illnesses. So we have set some key priorities to be achieved over the next 3, 5 and 10 years. And we intend, in conjunction with our partners, to help people lead healthier lives and also enjoy a better quality of life. So we will strive to deliver excellence through a can-do attitude that delivers at pace, encourages innovation and accepts the taking of calculated risks, but is open and transparent. By having more focus on outcomes, we are better placed to tackle causes of ill health. And as I said earlier, we cannot do this alone. We will need to work with local GPs, local authorities, third sector, charitable organisations, the independent sector, most importantly carers, and our local population to deliver a whole system approach to the delivery of health and social care. We need to provide increasing care closer to home and more self-care to help individuals live more independent lives. And when people need hospital care, they should access it for a minimum amount of time and be cared for with dignity and respect. But it should be acceptable for people to travel to more specialist care as long as the pre- and post-operative care is available locally. Public services have a responsibility to build on the joint work that has already started as part of the health, social care and well-being partnerships by becoming more joined up. And we will continue to support the development of a single integrated plan here in Pembrokeshire. We must all work together and support the prevention agenda and provide a reformed, modern, more efficient health and social care system which addresses the current health needs of the population as well as the challenges of the future. As individual organisations, we will fail, but together we will really make a difference. And as Pembrokeshire Local Service Board, we have the commitment of all organisations to make this work. I'll just share with you a number of commitments that we're making to the health and to our local population. And these include helping people to lose weight, helping people to stop smoking, helping people to stop drinking to excess, increasing by 20,000 a year the number of people treated in the community setting that would have previously been treated in hospital. We're also working with people in order to make sure that we can manage long-term conditions more effectively, so that there will be no unexpected admissions to hospitals. And we want to reduce the number of people dying with cancer and indeed prevent strokes within the communities. So we are already making good progress, and there are some fantastic examples of collaborative working. The co-production work with the third sector, South Pembs Hospital leading the way in Wales in joint working with our health and social community teams, and many, many more. And if I was to give us a school report, it would say making good progress, but there is much more work to be done. Finally, can I also then thank you for your interest in turning up today on what is a typical Pembrokeshire day, to help us shape our single integrated plan, and more importantly, to help us shape better public services for the people of Pembrokeshire. Together, we can really make a difference. Diolch yn fawr iawn, thank you very much indeed. I'll now hand over to you, John.